Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, we're talking today about infertility. And Dr. Prather, how common is infertility?
The official numbers are about 10% of the population has been diagnosed with infertility problems.
That'd be women.
That would be women. And actually it's about 50-50.
Oh,
when you're talking about infertility issues, it's not just the women have the problem, but it could be if you're looking at the responsible party on the infertility, it's about 50-50 men and women.
Interesting.
So, it's not just a woman's problem, but it's also a man's problem too. And so it is about 10% of the population, but interestingly enough, it is actually a growing problem. It's getting worse.
It's getting worse, and we're going to talk about why that is. But what role does the Prather practice, play in treating infertility? There's kind of a funny, because we have treated infertility and have had great results, and I think I met a patient that you were treating for infertility for the first time, and she said, "Yeah, your husband got me pregnant." And I'm like, "What?"
It does make interesting conversation at dinner parties.
But what role does structure-function care play in treating infertility?
Well, as you're looking at infertility, there's, of course, most people think about the medical intervention, IVF treatments, but when really, as you're looking at, the first step should be just trying to get healthy. Really, approaching this from a standpoint of things aren't working right, what's not working right, and then getting it functioning properly.
And what we talk about homeostasis.
Right.
So
once you're in balance, one of the things that, interestingly, that they've actually found is that this, like for male infertility, there's one way of actually increasing the ability of the sperm to actually work is actually adding vitamins and minerals right into the semen before they actually try to do the penetration, right? The in vitro.
Okay.
So that's one of the techniques that they've actually done and seen much better results. In other words, there's very strong proof that the nutritional content makes a big difference on the health and well-being of the being able to get pregnant.
It's really important that both the male and the female get healthy.
Correct. It's not just, a woman's issue, but it's often, it's, again, 50-50 men and women, and the healthier you are, the more likely you are to get pregnant. That's just the way it works.
So, is the Prather practice successful in treating infertility? I know in our last segment we'll have a story from Felicia on the success of that, a very inspiring story.
Yes, and one of the things is we have quite a few couples who come in for infertility problems, and we have an extremely high success rate. Of course, what the definition of being infertile is that you have had unprotected sex on a regular basis for about 12 months. And then that would be considered. But as we look at the percentage of who I kind of consider was our infertility patients, is a lot of them, most of them that we kind of consider, had already been through medical intervention trying to get pregnant. Were unsuccessful. And we have about between an 80 and 90% success rate, even with those men and women.
That have already been through the
Have
medical.
already tried the medical and was unsuccessful.
Interesting. Mm-hmm.
So, it's amazing, again, if you get the body healthy and people really, dedicate themselves to that, how successful that is.
Mm-hmm. And the medical intervention is so costly.
Yes, it's extremely costly, but also if you've been through it, oftentimes we need to really repair a lot of damage because it's really, really hard on the body. Mm-hmm. It's not a pleasant experience at all. Very emotional, very expensive, and really, really just wears out. And there's been quite a few women who I don't even care about getting pregnant right now. I just want to, my hormones are all a mess. I've lost weight. There's all sorts of different things that are going on. When we do their blood work, there's kidney damage, liver damage, that has actually occurred through it. Mm-hmm. And so we get them healthy, and as we're getting them healthy, all of a sudden they get pregnant too. So, it's a very rewarding type of thing.
Well, when does structure function care work best?
Well, what we're looking at with the structure function care is, there are situations where, IVF is really the only way. Mm-hmm. If there has been infections that have actually caused damage to the reproductive system, if there is some abnormalities, that really can't be fixed, that's when medical intervention is absolutely necessary, because there would be no way that we would be able to get the patient pregnant in those types of instances without direct medical intervention. So what we're looking at with the situation on that is basically there are things that are out of balance in through the system. There are toxins, there are infections, there are other different types of things that could be going on through the system that is preventing the body from becoming pregnant or even carrying a pregnancy to term. Mm-hmm. Determining what those are, figuring out the proper course is where we really shine through and just getting people healthy.
So what would someone coming in, with infertility, what would they experience? What diagnostics would you recommend?
The diagnostics that we would be going with on that, very thorough blood test. And we'd be looking at all the different basic functions of the body. We need to know, are there toxicities? Are there infections that are going on? Are there other different types of issues? Toxins. So blood work would be very, very important. Mm-hmm. We would also need to do a hair analysis. The reason that we're looking at that is there are certain types of heavy metals that are very well known to cause infertility. Mm-hmm. Lead would be a very direct one, and hair analysis is an excellent way to pick that up. We would also want to do see what's going on in the gut, because it has a lot to do with the immune system. Matter of fact, we usually find the key to endometriosis, which is a big reason why women can't get pregnant, coming from the gut. So as we fix the gut, the endometriosis goes away. So that's an important type of way, just really checking the body from head to toe. We need to know what the hormones are doing, just every single different aspect on that. Also, we need to determine the fat percentage of the body.
Does that affect infertility?
It does. You can actually be too low on your fat percentage or too high. Mm-hmm. The happy rate for best fertility is a body fat percentage of between 20 and 25% for a female. Mm-hmm. And that's where women are the most fertile. If they go, isn't that interesting? So, the fat percentage is also a very important part because it changes the pH of the body. It changes the endocrine system. And if you go off of, get the farther away from that number that you get, the less likely that you would actually be able to get pregnant.
You were saying that body fat percentage 20 to 25%.
20-25%.
Does that affect men also?
The fat percentage, yes. The men, if they are actually have basically a body fat percentage of above 25%, the higher that goes, the less fertile they are. You can actually go too low, but it's 14% or below, really, for a male, affects the fertility rate.
Interesting. Why is that? Does that sperm have to swim through the fat?
Well, there's actually changes in the testosterone level and the estrogen, because fat is will actually produce hormones. So as those hormones, and they aren't the good kind of hormones. So a male who has too high of a fat percentage will actually have quite a few problems along those lines. So their fertility rate actually drops.
Interesting. When we come back, let's talk about the different treatments at the Prather practice that have been effective in fertility. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. What do you mean by the statement, Dr. Prather, hormones the key to unlocking weight loss?
It's a very common type of thing that people come in and they say, I've been doing everything right to lose the weight. I don't know what else I can do. The hormones and the nervous system are the two things that tell the body what to do. The hormones have a very big regulatory type of effect on our weight. If the hormones say, no, you're not going to lose weight, you're not going to lose weight. Oftentimes, when we do some thorough evaluation, we find some issues and get that fixed, and it's amazing what happens.
What is your protocol for weight loss?
We do consult. We need to do a thorough consultation. We need to have a thorough examination. We need to have thorough lab tests. Then we need to put that together with the lifestyle of the patient. One of the first things that you have to do is you have to get those hormones balanced. And sometimes you have to cheat a little bit.
What does that mean?
Well, we have to sometimes fool the body. The body is stubborn, and it has a set weight limit. And I would actually put it as a picture of what you should look like. And oftentimes it's off. So we can use the hormones to fool the body to make a shift. One of the things that we offer is HCG shots, human chorionic gonadotrophin, and that is involved with, it works on the hypothalamus to tell the body it's okay to burn fat and change the weight, what the fat percentage is. So instead of burning muscle, which you normally do when you go on a diet, which is why most diets don't work, because you become more fat because the fat percentage increases as you lose weight.
It's wasting muscle.
And it's wasting muscle. This will burn up the fat and change the percentage of fat so that there is a true hormonal change. We can fool the body to change its set point because it can be pretty stubborn. We also keep very close records on the changes that are taking place. We measure the fat percentage. We make sure that people aren't just losing muscle. There are all sorts of strategies on diets, and we're very, very flexible in finding what diet works the very best. We make sure that they are healthy and able to follow it, and then incorporate a whole lifestyle, and then make sure that it stays. Because the last thing we want is yo-yo dieting.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. So we're talking today about infertility. And Dr. Prather, you said that it affects 10% of the population, and it's 50-50 as far as men and women.
Yeah, it's a very equal, it's an equal opportunity problem.
And it could be if a husband and wife trying to get pregnant, they both need to be checked.
Oh, absolutely. That should be something that is checked on both parts. And both of them, I encourage both of them to actually get treated.
Right. Well, let's talk about the different treatments here at the Prather practice that are effective in infertility.
Well, part of the the most famous one is acupuncture. Acupuncture, that's one of the things we have a very well-known acupuncture part of our practice. I'm a licensed acupuncturist, and so most women, most couples that are coming in for the acupuncture portion. But we also let them know that there's a lot of other things that we can do that can actually help that have been well proven to facilitate pregnancy.
Well, let's go back to acupuncture. How does that help in infertility?
And that's a big million-dollar question, because there's no doubt that there's quite a bit of results with acupuncture. As a matter of fact, a lot of infertility clinics, because it has improved the rate so much, is that they've added that in to part of their practice. So there's no doubt that helps. There is debate on exactly how that helps. One of the things that I have found is that acupuncture is absolutely amazing on two things. One, it reduces the inflammation in through the body. And inflammation, high amounts, especially in the reproductive area, will certainly kick off infertility. So a reduction in inflammation is one of the basic types of things. The other thing that it definitely has been proven to have an effect on is the hormones of the body. Acupuncture really improves the oxytocin, which is sort of your feel-good, happy place.
That's what I hear mostly from patients after their acupuncture.
Sure.
They feel so much better.
Right.
Yeah.
It's probably one of the things that you can do just to feel better immediately. People are like, did you put some drugs in those needles? Because I feel kind of a little drugged right now. And that's probably 80-90% of the people will say that after they have their first acupuncture.
That's a way to advertise it, right?
Yeah. Well, I have a lot of people who have sleep disturbances, anxiety. I've had so many people who, with some regular acupuncture treatments, no longer need anti-anxiety medication. So there's just this really feel good, and oxytocin high levels is definitely one of the hormones that really helps with fertility. So that's been very well proven, and we see that evident on every patient almost that we do. People go, I fell asleep. What's that?
I have needles in my body.
And it put me right to sleep. Well, how do you do that? So acupuncture definitely has an effect on both of those things. And both of those things has a big part in infertility. So that is a pretty good conclusion. There might be other reasons because, acupuncture and its effect hasn't been completely analyzed, but those are two that would be well documented online.
And I know the clinics, even in town here, either have an acupuncturist or they refer.
Absolutely.
And they refer to us. And
right. If you're going through infertility as an issue, absolutely acupuncture is 100% safe. No real side effects, and it would be foolish not to do that.
And also, if people can't get past the needle idea, we do laser acupuncture also.
Yes, we have other means besides the needle. And for those people who are squeamish about needles, which we do have them, we do the laser, and it does the same thing. Matter of fact, some people really like it even better.
The laser.
The laser.
Let's talk about chiropractic. What role does chiropractic play in infertility?
Well, chiropractic has been, of course, around for quite a while, and that is one of the things that is very evident. My grandfather was a chiropractor. I've seen been doing chiropractic for quite a while. And that's one of the things as you get the nervous system working well. You've got two master controllers of the body, the hormones, the endocrine system, and the nervous system. If those two things aren't working right, nothing else is going to work properly. One of the things that we find that is very common for women to say is once they started to get adjusted, they could tell a huge difference in their hormones. Their menstrual cycles became much more normal. So there's a tremendous amount of changes. So not only do we deal with the endocrine system, the hormones, making sure that those are all balanced out, but then also making sure that the nervous system is working properly. And that's what chiropractic does.
It's really working on the nervous system.
It's really a neurological treatment. And getting that, getting those chiropractic adjustments is something that I also recommend for infertility. Well, I recommend that for everyone, just to have the maximum amount of health. And people are surprised at how effective chiropractic is for solving those types of problems. And one of the things that we're actually very good within our office, because we also incorporate the rehab, is that we figure out how to keep the adjustments in place. And that's very important to people. And it's important to us too, because the longer you can hold an adjustment without having to get another one, the more healing that can take place in your nervous system. The more healing that takes place in the nervous system, the healthier you are.
Yeah, makes sense. Let's talk about hormonal balance. Why is that so important in infertility?
Well, the endocrine system is sort of the master of the fertility. So if that's not working properly, that is a huge issue. And you're talking about quite a few different portions of the endocrine system that have to be involved in that. You've got the pineal, pituitary, hypothalamus. You've got the thyroid that has to be working properly. You have the ovaries, uterus. All those types of things have to be really working properly for fertility to occur. And to be honest with you, most people that we come in and we do hormonal checking on do not have properly functioning endocrine system.
Why is that?
There's a lot of stress on the bodies right now, but there's an awful lot of other things that are occurring. We have a tremendous number of toxins. One of the main theories on why infertility is actually increasing is because of the toxins that the bodies are actually exposed to. We have 85,000 known chemical toxins that affect the endocrine system right now.
85,000.
85,000. And as you do, they do randomized studies on people just to see what the levels are. The levels are way out there. And with those kind of levels of toxins in the body, it's almost impossible for the hormonal system to actually work properly.
And these toxins are coming from our environment, our foods?
Our environment, our foods, and it's things that we're adding to the environment. It's man-made things. So we are poisoning, and that's one of the reasons that they feel that there's an increase, because the rate of fertility, the younger... In other words, a 20 to a 25-year-old has a much greater chance of infertility than through their lifetime than someone who was now in their 50s.
Oh, because the toxins are increasing.
The toxin level has actually increased, and they're not just finding that in humans, but also in animals. Fish and frogs are actually more sensitive because they're smaller, more sensitive to the environment. They're sort of like the canaries.
The fish and frogs.
Right, fish and frogs. So there's quite a few scientific studies, and there's a huge amount of not only infertility within humans, but also within the animal kingdom now that didn't used to be there. And it's actually much higher on animals now than it is on humans, because they're the first ones to have the exposures. So, we are developing a problem, and then being aware of that. But it's not just the chemicals that we add into our environment, but some of the things that we actually take in. One of the biggest problems with infertility is, alcohol, drug use. Marijuana is something that will definitely cause infertility.
Why is that?
Especially in males. The chemicals that are involved in marijuana have a feminization on males.
Wow.
And the more marijuana that you use, the more likely you are to be infertile.
Slows everything down, huh?
It does, and it actually changes. There are very strong changes within a male on his ability to reproduce the more marijuana he takes in.
Be interesting if they do studies in these states now that have legalized it.
Yeah, and it's a very strong feminization. There are actually feminization things that actually start to change in a male.
Wow.
With marijuana. Over alcohol use also has a big effect, but all those things.
When we come back, let's talk about vitamin and mineral deficiencies and how homeopathic medicine helps with infertility. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
So I've gone in the surgery room, and they hadn't sedated me yet, and they start strapping down my arms and my legs, which is kind of freaky. I'm like, what's this about? They're like, well, once in a while, every now and then, on occasion, people wake up during surgery and try to get away. I'm like, oh, really? I'll tell you what, if I wake up during surgery, you take that bedpan over there and whack me over the head with it. Because that's what I'm going to try to do to you.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Well, we're talking today about infertility. And Dr. Prather, one thing I want to bring up before we get into more of the structure-function approach to infertility, which has demonstrated some great results.
Mm-hmm.
You were saying 85 to 90% success rate.
Right.
And why wouldn't someone want to go this approach before?
Yeah.
I mean, I had sister-in-law go through the in vitro. You know, she was 2 states away. Mm-hmm. Decided she couldn't commit to the structure function part, and unfortunately was unable to get pregnant through the medical route. But for 2 years, she didn't sleep.
Right.
I mean, it wreaked havoc on her hormones.
It was actually dangerous.
It was.
It almost killed her.
Uh-huh.
It almost killed her.
Mm-hmm.
So, yes, that's one of the things that is the side effect that we have with our treatment is that people feel really good. I had one woman who really dedicated herself to doing it. Mm-hmm. And we had most women get pregnant. You know, I usually say within a 6-month period. Mm-hmm. And it took longer. It was about 8 months. she was about ready to say, well, I'm not quite sure, if I want to continue. But she says, I feel so much better. She says it was worth it. She did manage to get pregnant.
What do you mean she managed to get pregnant?
Well, it happened, and she had actually given up and said, "Oh, I got pregnant," without even thinking about it. And then after 2 more, she called me and says, "How do I get it to stop?" She says it's turned on, and we've got 3 now, and so can we stop the process, because we didn't try after we didn't even try for the first one, but it's just kind of happening at that point. So that's one of the side effects, but that's one of the things that everybody says is, wow, doing it this way, I feel so much better, and it's just worth it along those lines.
Yeah, because with infertility, there's something out of balance.
Yes.
Yeah.
Another little story along those lines I had when I was doing the acupuncture. I had one woman who we were doing acupuncture, getting it balanced, and that's all she wanted to do, and she really just loved it. But one of the things that happened is she came in and she says, I'm pregnant. And I said, well, is that good? And she said, oh, yeah. But she says, just to let you know, I went through IVF treatment 3 times before that. And no success, and I finally gave up, didn't even think about it.
Had to probably take out a loan.
Right. She said it was awful. But she said, without even really trying, just the acupuncture alone, she says, that's amazing.
Yeah. Well, let's talk about vitamin mineral deficiencies and how they can contribute to infertility.
Very definitely well proven. Matter of fact, they have shown that even adding vitamin minerals directly to the to the semen actually makes a difference on the motility and fertility and the ability for the sperm to actually work. So there's no doubt that that's actually plays a very big role, but there's a direct correlation between quite a few different vitamins and minerals on fertility rate. One of the biggest ones is the copper zinc. One, that there has to be enough of both of those, and then you also have to have the right balance between them.
Copper and zinc.
So that is a big area of fertility. If you're low on your calcium, magnesium, if they're off, that also plays a big role. Certain vitamins, vitamin D, a lot of the fat-soluble vitamins are very important that they're up to a proper level. Iodine. Iodine is a very much of a magic fertility.
And a big issue here in Indiana.
It's a very big issue, as we do.
Low iodine.
We have tremendous number of people with low iodine, low vitamin D, and that directly affects the fertility. Even the levels of vitamin C, just a very common type of thing, can affect that. And all those things can be checked, whether those are balanced or not. We have lab tests that we can check each and every single item on that, and getting those balanced out. One, definitely helps with fertility, but 2, it makes you feel a lot better and you're a lot healthier.
Yeah. If they're injecting that, into the semen,
right?
Why not?
Why not get it into people? And so, in other words, there is no doubt that those things have a very direct relationship with fertility, and something that can be looked at, really clearly. Much cheaper way of approaching it. So cost-wise, it makes sense. General health, it makes a huge amount of sense. And then there's no doubt on an increased chance of fertility, of conception.
Well, and I'm convinced, too, when you talk about labs are only as good as the one interpreting them.
Yeah.
I just hear, well, my family doctor looked over my blood work, everything looks fine. And then we look at it in a structure-function model. You have 600 hours of just studying lab work in your diplomat of chiropractic internist. So you go about it a different way,
But let's go on. Let's talk about homeopathic medicine and how it helps with infertility.
Well, there are some things that are just very difficult to get out of the system. You know, we talked about some of the chemical issues.
Right.
And trying to detox the body out of there can be rather difficult. But that's one of the great things about homeopathics is we can target different types of toxicities in the body, and we get rid of them. It's a very, very specific. It can really solve some of the problems that kind of are very difficult. So if we have real problems in any different type of situation, the homeopathics make the quickest changes, but it works naturally. Mm-hmm. So homeopathic medicines are really, I find, on my tough cases where people come in and have some really strong issues. One of the things that we had was that we had a male who had done quite a few bit of marijuana in his days, and he was the one who was infertile. So we did basically got all the nutrition adjustments, acupuncture, those types of things. But really what was necessary is we gave him a homeopathic detox for the marijuana toxins that were associated with that, and got that all detoxed, and he became fertile. Interesting. At that point. Mm-hmm. So in those types of situations, there can be some chemical toxicities which can be checked on. Mm-hmm. And really, for a lot of those types of things, the only way to get those out, if you go about it in a conventional means, the chelation, different types of things, can be rather traumatic. Mm-hmm. Whereas homeopathics, we can get in there and hit those specifically, and very effective, not traumatic to the body. So with our really tough ones, the homeopathics are really, really helpful.
I love homeopathic medicine. Love it.
Yes.
Let's talk about birth control pills.
Yes.
I had chosen never to go on birth control pills. We had no problem. For the listeners out there that don't know, we are married. We didn't plan a thing, but
3 wonderful kids, and then we had to figure out how to stop it.
But let's talk about birth control pills. How
Sure.
do they affect infertility?
Those are a very big contributor to infertility issues. Mm-hmm. When we're looking at women who have been on birth control, I said, don't even expect to for a period of time to be able to get pregnant. Mm-hmm. Your body has to recover over certain periods. So for every year that you were taking a birth control, expect a month.
Okay,
for the body to recover.
Some of these women have been on birth control for years, or
Yes.
started when they were 13 or 14 for acne,
Right. And it does, you have to fix the endocrine system because it's not working properly. Mm-hmm. So it does take some time. It has to be detoxed out of the system. Again, homeopathics are absolutely necessary in that type of situation, but getting that balanced out will take a while.
Okay. Well, stay tuned, because for our next segment, we're going to hear from Felicia, who's going to share her journey to getting pregnant using structure function medicine here at the Prather practice.
Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, you talk a lot about structure function care and disease care. What is the difference between the two?
When you're talking about disease care, you're usually talking about an interference in the body's normal mechanisms. There is a time for that. When the body is actually in a process of free fall, is a good way to kind of put it, where the body is no longer making sense of what it's doing. and we're on a pattern that it will actually crash, then you need some interference. And the best way to actually do that is through pharmaceuticals. Pharmaceuticals are classified as poisons. They actually take the body further away from homeostasis, which I'll define here in a second. But at those times, that is actually necessary. So when the body's in a crisis and is no longer able to heal itself, that's when disease care is actually critical. That's where you actually utilize the pharmaceuticals and the surgical methods. What we're usually involved with is in structure function, and as opposed to a disease care, it's health care. Everything that you use in a structure function standpoint is something to bring the body back into homeostasis, which is balance.
Okay.
Dr. Guyton talked about homeostasis as the definition of health. If the body can maintain homeostasis, where it's in a perfect balance with all the different types of things that are coming in that are interfering with its function, that is the perfect state of health, and that's based on a balance of the physiology, functional, and upon the structure portion of the structure function.
Well, you talk about the body as the hero. What do you mean by that?
Body has a self-healing mechanism to it that can just make all sorts of corrections if we can just get out of its way. The whole idea behind healthcare is to provide the impetus, the needs, and the basis of what it will take to actually get the body well. So finding out where it's off, doing the proper diagnostics, and then making the proper type of adjustments into the care will actually result in the healing and the position that the body should actually be in.
We'll find out how structure function care can impact your life. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
Don't stop believing. On to that greener, yeah. Street light.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Well, I have Felicia with us today. Welcome, Felicia.
Thanks.
We're glad to have you here, and you want to tell your story today, and your story started at a very young age with your health care. Tell us a little bit about when you got introduced to chiropractic care.
Yeah.
You probably don't remember.
I don't remember. I started going to Dr. Prather when I was a newborn. Straight.
And how long ago was that?
That was 32 years ago.
Wow.
Yeah.
Wow. And so your parents, is very important for them.
Yeah.
For you to get aligned, and it's a very gentle approach.
It's very gentle, especially with babies. Yeah.
And I know you have your own children. You have two children and one on the way. We're going to talk about that.
Yep.
Why is it so important to you, the chiropractic care?
Probably, especially with Dr. Prather's practice, it's a very holistic, holistic healthcare. It can cover anything, really, in my opinion, that you're dealing with, whether it's aligning your body structurally, or your vitamins and minerals, or metals, or even things like infertility. It can help with.
And you had infertility issues.
I did. My husband and I, well, it started a couple years ago when I just started having very strange symptoms, and the final straw was I miscarried. And it was our first miscarriage, and it just hit us really hard. And when I started talking about it with Dr. Prather, he said, we better run a hair analysis and see if there's any metal toxicities. And when we did that, we found out that I actually had lead poisoning. I had been overseas, and that's probably where I got it, though. I mean, you can get it anywhere. But I had lead poisoning and cadmium and poisoning and some copper zinc imbalance, where my copper was high, my zinc was low, which that in particular can cause, both that and the lead poisoning can cause miscarriage and therefore infertility afterwards. And we were trying for almost a year after that and couldn't get pregnant, and we had always gotten pregnant actually the first month we had been trying before that. And so I got the metals through different supplements and even a tea. I got the metals taken care of, and since then all my hair analysis have come back clean. No more metals. Nice. So there's been clear proof that they're taken care of. And then Dr. Prather suggested acupuncture for internal healing for the infertility. And I had actually been having irregular periods since my second child's birth, which was around the time that I got the lead poisoning. And the very first, it was a 12-week session of acupuncture twice a week. And after the first couple sessions, I had my first normal menstrual cycle. And then after the acupuncture finished, we got pregnant right away.
Wow.
So that was one of the biggest blessings, I feel like, that the chiropractics has helped.
So it was the combination of the toxicity in your system.
Yeah.
And then doing the internal healing.
And part of that was because I had had 2 emergency C-sections with my first children, and so that healed a lot of the damage that had been caused by that. So, yeah.
Now, you talked about being overseas, and you were pregnant with both your children overseas.
Yeah. And
your daughter, talk a little bit about, she was having difficulty moving her neck.
Yes. Yeah. When, well, she's had a number of issues throughout the years. When she was born, we had come back to America for the birth, and when she was born, it ended up being an emergency C-section, partly because she hadn't been growing well inside me. We were in extreme altitude, higher than Denver, about 10,000 feet above sea level, and it just, for whatever reason, and doctors aren't sure why, but for whatever reason, it caused her to have growth difficulties even when she was growing inside me. And when we came back, but I was overseas for the whole pregnancy, and when we came back for the birth, it ended in an emergency C-section. But at that point, she could not turn her head one way. One way she could, and the other way she couldn't, and she started developing an extreme flat side to her head, which really concerned my husband. Not me as much, but we took her to Dr. Prather, and immediately he said her C5 is locked, and it's a common problem with C-sections especially, but any birth can have it. And so he just very gently adjusted her neck. There's no cracking involved, just extremely gentle chiropractics. And she immediately turned her head. Immediately. And it is the first time that my husband and I had ever seen her turn her head that direction. So that was a huge blessing in her.
That is so important.
Normally after that.
No flat head. No. Dad was okay with that.
He was thankful.
So what if she can't turn her neck? I don't want the flat head.
I know. Well, and what I actually found out from her pediatrician later was they had been concerned about it, and they had been considering surgery.
Oh, I didn't know that. Wow.
And I had a friend that actually went through the surgery with her child and regrets it incredibly. But it's a common problem with C-sections, and it's common for doctors to do after a few years.
Let me let our listeners know you said C5. It's that cervical
it was
vertebrae in the neck.
Yes, a spot in her neck. And I was so thankful because, I mean, you're talking about a surgery versus a very gentle, quick 5-second adjustment, and it entirely corrected the problem. She's never had a problem turning her neck since then.
And, just helping her developmentally.
Right.
If you can't turn your head.
If you can't turn your head, yeah.
It develops reflexes and matures
absolutely.
reflexes.
And then after we went back overseas soon after she was born, a couple months, and we were back in the high altitude, and she just continued to have growth problems. In fact, by the time she was 2.5 years old, she had just barely gotten into 9-month clothing, if you can imagine. Incredibly small. And so we actually, for that reason, as well as just she was so thin, and so we just couldn't get her to grow and thrive. We needed to return back to the States. And when we did, Dr. Prather checked her and said that her natural growth hormones were off, and were very slow. And so he gave her just one supplement for it. And after that, she started growing like a weed, and now she is well within the normal range. Still on the small side, but normal, and my husband and I are small, so yeah, it just changed everything, just one supplement. So
that's wonderful.
Yeah, we're so thankful.
Now, how do you use Dr. Prather's office and healthcare now in your family's life?
At this point, we have, Dr. Prather has suggested having the children get a hair analysis every year, just to make sure there's no metals. And my husband and I, every few years. And then we go in for fairly regular adjustments, just to stay in alignment. When we are sick, we often come. There's a lot of things that Dr. Prather can do rather than taking antibiotics, which lower your immune system. For example, our children got bronchitis this last year, and Dr. Prather had a medicine that worked wonders. Just as effective as an antibiotic and way less side effects.
Right.
So things like that, or even strep, can be treated. Keeping their vitamins up, or our whole family's vitamins up. My husband's been having some kidney problems, and so this summer he's gonna start coming for some acupuncture for his kidneys. And then I'm pregnant at this point, so having regular adjustments through this pregnancy has been wonderful.
And you're going to bring that
so
newborn baby, just like you started.
And we will bring the newborn, absolutely.
And the pregnancy's going well?
It's going really well. Since I've had 2 C-sections, this one will likely be a C-section as well, just because of the risk factors after 2. And so I'm actually going to have acupuncture after the C-section to help with healing. And even it'll help lessen the scarring.
Wonderful.
And so, yeah.
So people listening out there, that might be interested in any aspect of your story, or something in your story hit them, maybe a mom, or someone that's had difficulty getting pregnant, what would you say to them?
I would say that it's worth the try. Even if you aren't sure that it's going to work, or even if you really don't think it will, why not try it? Especially over something like a surgery, or even over, the cost difference between getting some acupuncture for infertility and going through all the infertility treatments is an astronomical difference. And if you can do it that simply, why not at least try it?
Right. Well, good. Well, thank you for sharing your story, Felicia.
Yeah, thanks for having me.
Great story, and we wish you the best in your pregnancy.
Thank you.
Can't wait to meet your little guy.
Yeah, you'll see him right away.
Thank you.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop.
If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.